And Jamelle Bouie and Michael Graham are here with me now in Washington. Jamelle is a CBS News political analyst and chief political correspondent for Slate. And Michael is creative director at MediaDC. He's the publisher of the Weekly Standard, the Washington Examiner, and Red Alert Politics. And I'm glad to have both of you here. And it strikes me, listening to Congressman Kelly, that Republicans have an almost impossible task here, which is that on one hand, they need to convince the public that the rug is not going to be ripped out from underneath people and that this plan is going to do nearly everything that Obamacare did. But then at the same time, they're trying to convince conservatives that their plan is nothing like Obamacare and it's much more streamlined and it's not big government. So how do they do both and how are they doing it both?
Well, one disadvantage Republicans have is that they don't when President Obama sold Obamacare, and if you like a doctor, you keep your doctor, you didn't have this glaring example of something similar just collapsing. So, Obamacare hasn't worked. Everyone who's, pretty fiscally honest about it, just hasn't worked. Putting 11 million people on Medicaid, which is a terrible healthcare system that people should not have to rely on because the services are so bad, was not what people thought they were getting. So the Republicans have not just, hey, we want you to buy our snake oil, which is pretty much what they're selling, but ignore this bottle of snake oil you bought last Thursday. So they're in a real bind.
Jamelle, do you think that Republicans are succeeding in convincing the Republic that this plan is going to be better for Americans than what they've got now?
So I want to say real quick that patient satisfaction surveys of people in Medicaid show that majorities of people who receive Medicaid say that they like the services. So, of course, there are ideological differences about the program, but as a matter of public opinion, people who receive Medicaid say they like Medicaid.
And certainly if you didn't have any insurance before, you'd probably like Medicaid better.
So two things. The first is that I'm not sure Republicans have sold the public on this yet. Quinnipiac survey came out today showing that around 51% of Americans say that they don't want President Trump to support repeal of the Affordable Care Act. And that's a major obstacle for Republicans, given that that includes undoubtedly some of their voters and supporters. And as we've seen already, there are people in Republican-controlled states and Republican districts that receive benefits from the Affordable Care Act that don't like it. The second thing I'd say is that this is sort of a very unsatisfying middle for Republicans right now. On the right flank, you do have the, hey, this is not a full-fledged repeal, what are you doing? On your left flank, you have, we don't want to throw our constituents to the wind. And in the bill itself, you have a bundle of policies that don't actually solve any particular problem. So, for example, these subsidies pegged to age. There are counties in Pennsylvania, for example, where someone right now under current law would get substantial subsidies under the Affordable Care Act, and they'd lose something like 60% of that under this new law. That's not a person who's going to be particularly thrilled about what's happening.
By the way, I agree, but I just think you have your number of flanks is too small. There's many, many more flanks. And one of the flanks that is ignored at the Washington Examiner, we have Phil Klein, who works there, who's written a book specific on this, that what Republicans have always argued is that just as you described, you have the Obamacare never was going to solve the number one problem, which was that prices kept going up faster than the economy, faster than inflation. There was nothing to put this force of the free market to drive down prices and unleash better service. Well, the Republican plan in the step one they have doesn't do that either. Like you said, it's trying to kind of stopgap, make some people happy, not too unhappy. And now they're telling us this is phase. Well, it's three phases, because phase two, the Health and Human Services Secretary will step in with his wide latitude, and he'll fix a bunch of stuff through deregulation. And then phase three, we'll get something like free markets, and that'll help solve the actual problem. So it's basically the wimpy hamburger healthcare repeal. If you'll give me a crappy deal today, I'll gladly give you something good on Tuesday.
I think one thing Michael's touching on that's really important is that with the Affordable Care Act, Democrats spent the better part of 3 years, if you kind of start the process in 2006 or 2007, getting buy-in from virtually everyone.
Yes.
From liberal senators and conservative senators in the Democratic Party to hospital associations, to every possible stakeholder. Democrats,
they wanted to avoid the AARP coming out and saying, we don't support this plan.
Republicans haven't done that work. And that by itself is a tremendous handicap as you're trying to go forward.
In their defense, they did not know that they were going to have this opportunity until until November of last year.
They caught the car bumper.
But I'm even more mad. As a long time, we've editorialized about this path forward that involves unleashing the power of shopping, that people can understand that. I mean, what's better 10 years later, your mail service or your cell phone? Your cell phone 10 years ago was bigger and more expensive and did less stuff. Why is it so much better? Free market. Your postal service still is the postal service. That's an easy to understand paradigm. If the Republicans would A, lay it out with a real plan, and then B, explain it. And they're doing neither. And I happen to agree that we're kind of for Republicans right now, they're in the worst of both worlds.
It's unclear to me, so you've got these conservative holdouts who say they want to negotiate, some of them, but it's unclear what form that negotiation will take and what, if anything, can really satisfy them. I mean, if you are against tax credits and you feel that it's a new entitlement, simply reducing the size of the tax credits is not necessarily going to be enough to get you to vote yes.
I think that's basically right. I think Republicans have kind of caught themselves. They're caught in the vice of their own rhetoric over the past 7 years. That for since the bill was passed and before the law was passed, Republicans have argued precisely this: that the entire structure of this thing is nonsense, that it's collapsing, that it's a disaster, and now you have a replacement bill that maintains the structure of the law, and so that by itself means you're in.
Unless you're talking to conservatives, and then in that case, you're getting rid of everything of the law.
But they don't have the votes. I do think one thing that the Republicans do have going for them, though, is that they do have the backdrop of this wide dissatisfaction with Obamacare. You mentioned one poll, but consistently for 7-8 years, Obamacare has been underwater, stays underwater. Well, just very quickly, I think because when you ask lots of people, how is your life different? Obamacare helped a relatively small number of people in a country of 320 million, but it put mandates on almost everybody. And the free market can flip that so that almost everybody has some benefit. And but once again, you have to have a bill that does that, and they don't have that right now.
What's funny, though, is that one of the reasons why the American Health Care Act retains so much of the structure of the Affordable Care Act is that in the drafting stage of it, they were proposing a measure that would, in fact, add a healthy dose to the free market, getting rid of the employer health insurance tax exemption. And it turns out that if you do that, you radically disrupt the healthcare markets in a way that the Affordable Care Act doesn't even touch. And so you can't, for Republicans, you can't simultaneously say, we're going to provide you cheaper, better coverage, and you won't lose your doctor, and so on and so forth, but also introduce what you're describing as free market reforms.
Right. I want to switch gears here because there's another big story that Washington was transfixed by today. Two interesting storylines, in fact, regarding Mr. Trump's wiretap allegations. Let's go to Margaret Brennan at the White House for the latest, and then we'll discuss.
Nancy, if we take President Trump at his word that he was indeed wiretapped, that would mean either the FBI illegally listened in or that they legally did so in the course of a counterintelligence probe. Today, I asked the White House Press Secretary Sean Spicer if the president is indeed the target of such an investigation.
I think that's what we need to find out. The president has made it clear he has no interest in Russia, and yet a lot of these stories that come out with respect to that are frankly fake.
He doesn't know whether he is
well, no,
but
I think that's one of the issues that we have asked the Senate and House to look into.
Are you saying that there is a possibility he is the target of a counterintelligence probe involving Russia?
I don't know. The answer. No. I think what I'm saying is that there is a difference between that narrative and then the narrative that has been perpetuated over and over again. The concern that the president has and why he asked the Senate and House Intelligence Committees to look into this is to get to the bottom of what may or may not have occurred during the 2016 election.
The White House has since said that Mr. Trump may have been swept up in surveillance collection, not directly targeting him, though the president did say it was his phones that were tapped, something that the Director of National Intelligence, James Clapper, has denied ever was the case. Now, we did see today Senators Lindsey Graham and Sheldon Whitehouse send a letter to the Justice Department requesting copies of any warrant applications or any court orders regarding wiretaps related to Mr. Trump, his campaign, and Trump Tower. But they said if there was enough evidence to have given a warrant, that in and of itself is of concern. Nancy?
Margaret, thanks. And Michael, it seems to me that all of professional Washington is sort of operating in a charade at the moment where congressional Republicans, White House aides, all have to pretend that possibly the president got this information from a legitimate source, and if so, then it's very concerning and it needs to be investigated, even though everyone knows that he read it in a conservative publication or heard it on a right-wing radio show, and that it is not true.
Well, that's what you think, but now that we know that the CIA is using our telephones and cell phones and microwaves, maybe he heard it from a household appliance.
You never know.
Possibility.
Chances are, though, it came from Mark Levin.
This is classic Trump, where is it possible that that there were warrants pursued over the summer and then was turned down for his building, whatever? Is it possible that the Obama Justice Department had people in it who maybe were thinking politics at the same time it happened? That's possible, sure, particularly with the Obama record on using the IRS to attack their political opponents and going after reporters that they didn't like. But how about some evidence? And the craziest part to me, excuse me, you're the executive branch. The DOJ is like in your building. Remember from civics class and the legislature? So he goes to the legislature. Hey, could you come over to my house and tell me, dude, pick up the phone. Call somebody at the DOJ. What FISA warrants you got? We could resolve this so easily. It's crazy to watch.
But Jamelle, you've got folks like Sean Spicer tying themselves in knots, trying to square this circle.
I mean, this is what I find just profoundly disturbing about all of this. And it's very easy to laugh about it that, President Trump gets up early in the morning and watches TV and listens to the radio and like, someone's uncle or grandfather has a crazy idea and then tweets about it. The problem is that A, he's the president, and B, just by virtue of that, people take that seriously. And so you have the press secretary trying to defend it. You have congressional Republicans, or at least some congressional Republicans, saying, yeah, maybe we'll investigate this. And all of a sudden, we're in this world where the president can talk about conspiracy theories, put forth conspiracy theories, and there's something we now all have to litigate. And this damages our public notions of what is true, of what is false. It damages our ability to have any kind of sustainable dialogue. Because in this world, if I tell you something that is factual and grounded, and the president says, no, I heard this thing on this radio show, then we have to take that claim seriously because the president said it. And that makes discourse impossible.
But there's also the other side, which is there are people who are listening to this assertion that Team Trump and their campaign workers were getting phone calls from Putin's office. And every time anybody with information is asked, they always say, we've seen zero evidence of this happening. And yet, if you watch the media coverage and listen to Democrats, they assert it as though it is virtually a known fact. And so this is the consequence of kind of letting partisanship get ahead of us across the board. And just one thing I'll add, people ask all the time, how can anyone believe the crazy stuff Trump says? People on the left don't understand how the last 8 years of watching what people believe fairly and unfairly, the rules were broken to get Obamacare through. No one cared about these little ladies starting tea parties and getting investigated by the IRS. Nobody cared. And now they feel like the rules have changed. And now they're so suspicious that they're willing to listen to things that maybe 10 years ago they would not have.
I'll say real quick, though, that Obama wiretapped me is of a different category than the Russia allegations, where we know that members of Trump's team have relationships with figures in Russia. We know that Jeff Sessions had meetings with the Russian ambassador. Now, what all of this means, that's where there's all this speculation. But there are actual hard facts here, and it is the case that key members of the Trump team during the campaign and the president have been very evasive, if not misleading, about those connections. And so there is legitimate plumes of smoke here in a way that there is not with Trump's assertion.
And that's where I disagree with you, because, for example, to say that Jeff Sessions had meetings with the ambassadors when one of those meetings was he was giving a speech and the guy was in the crowd with other ambassadors. That's not a meeting. They did have a meeting, yes. He had a meeting with 26 ambassadors. I'm not saying that there's not some smoke, but once again, people are really pumping those bellows hard to create a lot of smoke out of a little bit of steam. If everybody would try to ground back to the facts, I think we could maybe make some progress in some shared space.
Jamelle Bouie, Michael Graham, thank you so much for joining me tonight.
Thank you.
Appreciate it.